Hello everyone, welcome back to the channel. Today's video is a detailed breakdown of the Great Healthcare Plan by Trump, including all the key updates coming in 2026, what the plan actually proposes, and what it means for everyday Americans struggling with high medical costs. In January 2026, President Donald J. Trump formally announced this healthcare proposal as a comprehensive strategy to reduce the cost of prescription drugs, lower insurance premiums, hold big insurance companies accountable, and maximize price transparency across the U.S. healthcare system. In this video, we'll walk through each major piece of the plan, explain how it's supposed to work, look at the latest changes and reactions, and discuss the questions that remain unanswered. Healthcare in the United States has long been one of the most expensive in the world. Millions of Americans pay sky-high prices for prescription drugs, hospital visits, and insurance premiums, often far more than people in other developed countries pay for the same care. For years, U.S. policy debates have focused on how to make healthcare more affordable and transparent. Trump's administration argues that existing systems have failed to deliver lower costs for patients, instead benefiting big pharmaceutical companies, major insurers, and special interest groups. The Great Healthcare Plan is presented as a broad framework designed to put patients first, shifting power and money back to individuals, increasing competition, and making costs easier to understand. One of the cornerstone features of the plan is lowering prescription drug prices. Under the proposal, the U.S. would ensure that Americans pay no more for medicines than the lowest price paid in other developed nations. This is often referred to as a most favored nation pricing approach, meaning if another country pays less for a drug, Americans should pay that same price too. Trump and the White House claim that this strategy can cut drug prices dramatically, in some cases by 80 to 90%, and that new platforms like TrumpRx.gov will help consumers access these lower prices directly. The plan also allows certain safe pharmaceutical products to be sold over the counter, which reduces the need for a doctor's visit and saves money for both patients and the healthcare system. If implemented, this could be one of the most significant changes in U.S. drug pricing in decades. A second major goal of the plan is to lower insurance premiums, the monthly payments people make for health insurance. Instead of sending large subsidy payments directly to insurance companies, the plan proposes redirecting that money straight to eligible Americans so they can buy the insurance plans they want. According to White House numbers, funding this approach, along with fully supporting cost-sharing reduction programs, would save taxpayers at least $36 billion and could cut premiums on the most common marketplace plans by more than 10 to 15%. The idea is that by increasing consumer choice and competition among insurers, prices will naturally fall, and individuals and families will have more flexibility in how they obtain coverage. A unique and often emphasized part of the plan involves what the administration calls the Plain English Insurance Standard. Right now, many insurance policies are full of technical jargon that's confusing to consumers. The Great Healthcare Plan would require insurers to publicly post clear rate and coverage comparisons, the percentage of revenue spent on actual claims versus administrative costs and profits, the percentage of claims rejected, average wait times for routine care. All of this information would have to be presented in straightforward, understandable language. This transparency is intended to empower consumers to compare plans more easily and choose options that offer real value rather than hidden costs. Another major focus is expanding price transparency across the entire healthcare system. Under the plan, any hospital, provider, or insurer that accepts Medicare or Medicaid must display their prices and fees publicly, meaning patients would be able to see costs before treatment, not just after receiving a bill. This is designed to eliminate costly surprise billing and help families shop around for the best care and price, much like how we compare prices for other big purchases in everyday life. Now, let's talk about what's new in 2026. The plan has been officially announced, and Trump is actively calling on Congress to pass it into law. The administration has already negotiated drug pricing deals with over 14 major pharmaceutical companies to bring prices in line with other countries, and savings have begun appearing on TrumpRx.gov. CMS, Council for Medicare and Medicaid Services, is pushing updated rules that would strengthen price transparency requirements, including ensuring that pricing information is accurate and accessible to all consumers, online or offline. These actions show the administration is not just proposing ideas, but also taking steps to begin implementation. However, the plan has also drawn criticism and skepticism from health policy experts and lawmakers. Some experts say the proposal is still very broad and lacks clear implementation details or funding mechanisms. In other words, the framework exists, but the law does not yet exist. There are also questions about coverage, especially for people with pre-existing conditions, and whether redirecting subsidies might reduce the security offered by the Affordable Care Act's marketplace plans. Critics argue that without strong legislative support and detailed rules, the plan might leave some Americans with higher out-of-pocket costs or less coverage overall. Many of these issues are still being debated on Capitol Hill. So, in summary, the Great Healthcare Plan aims to cut drug prices, reduce premiums, hold insurers accountable, and expand transparency. It proposes direct payments to individuals, not to insurance companies, as a way to empower consumers and increase choice. Actual implementation will depend on Congress passing legislation, and there are still important questions and criticisms being raised by experts and lawmakers. Healthcare costs remain one of the biggest financial burdens for families in the U.S., and this plan represents one of the most aggressive attempts in years to reform how healthcare pricing works. If you found this video helpful, hit the like button, subscribe, and turn on notifications so you don't miss future policy breakdowns. And let me know in the comments, do you think the Great Healthcare Plan will actually lower costs for Americans? Why or why not? Thanks for watching, and I'll see you in the next video.